Hi, my name is Melanie Endicott, and I am with HEMA International, and I'm here today to celebrate International Nurses Week, and I have with me Shawna Butler, and she's going to share with us some of her insights. So first, I'm going to have Shawna, why don't you introduce yourself to the audience?
Melanie, thank you so much for having me, and to the AHEMA team and community. It is really a pleasure to be invited to talk about some of the things that I care deeply about. So my name is Shawna Butler. I am a nurse economist. I am a health tech specialist and a catalyst. And more recently, I have been adding this hat that I hadn't necessarily been familiar with, but I realize I'm a media maker. I'm spending a lot of time helping to tell the stories of how health innovation happens, the messiest parts of it, and the glorious triumphs that ultimately happen when really good, committed people work with different tools and try new things and move past all the frustration and the regulation to help innovation create value for people around the world.
Great. Well, that sounds like fascinating work. So I'm excited to hear more about that. So let's get started with the first question we have for you is, how do you feel that nurses around the world can impact the future of healthcare?
So I love that, first of all, the supposition, the fact that nurses can. And I would actually just adjust that to say that nurses do impact the future of health. And not only do, and that comes from this rich tradition. I mean, we're celebrating International Nurses Week. And when you go back and you look at the date, that is tied to the birth anniversary of Florence Nightingale. So we often tie nursing innovation, health innovation, to her groundbreaking work, not only as a nurse, but as a data scientist, as a systems analyst, as an advocate, as a policy wonk. And so there is this long tradition that nurses have been impacting healthcare, things that they've done in the past, things that they're currently doing now, and things that they will do in the future. What I think is interesting that around the world is that nursing and nurses around the world represent a lot of people want to call it the backbone of the healthcare system. And it is the backbone, but I also think of it as a circulatory system and the connective tissue. They are at the center of distributing the workforce, or distributing the work, the health, the care that needs to be given. Every clinical interaction begins and ends with a nurse. When you think about when you've got something that's concerning you, whether it's health education, whether it's a splinter in your finger, whether it's an infection, whether it's a pregnancy or a heart attack, frequently when you go into whatever healthcare setting you have, you're going to see a nurse. And that nurse is going to stay with you the entire time of your care. They're going to coordinate your care. They're going to monitor your symptoms. They're going to execute any of the treatment plans. Wow, execute sounds like a really bad word here. They're going to deliver all of the care that you need. And then when it comes to the fact that you've improved, that you're at a place where you're ready to go home or to return to the life that doesn't require that intensive monitoring, the last person that you're going to see before you go home is going to be a nurse who's going to go over your treatment plan, any medications that you're on, your follow-up. And then when you go home or you return to your community or your family, what they'll tell you is, and if you're experiencing any problems, please give our nurse a call and they'll help you reevaluate what your situation is. So across the world, that is happening with every single situation, health situation. And we do that on the public education side, the public health side. We do it in the clinical treatment areas and clinics. Nurses are there in your hospitals. Nurses are they're in hotels. They're in refugee camps. They're on soccer fields. They're in schools. There are just so many of us, and we do so many different things. And we are there to help promote health, to take care of any illness, to take care of an injury, to manage a disability or a chronic condition. And when life comes to an end, we are there to help provide dignity for end-of-life care. And even beyond that, then there's that bereavement stage. So there is no stage, no place on this planet where nurses aren't making a difference in your current care, but then also in the future. And you asked about the future. Let me just say something about that. Because nurses are so close to every single one of those steps, what they see are the things that create an injury, the things that might create a health problem. And so we have this sense of, what do we need to do to make sure that something bad doesn't happen on that prevention side? Or we see somebody on a path where things aren't going really well. What can we do to nudge or to interrupt? And I think in the future, what we are learning is the role and the importance of primary care. I think many countries have actually seen that. They do invest heavily in primary care and the health and the human services side of things and the health side of things, because that is the major resource that they have. They don't have a well-developed sick care and disability system. And that's where nurses, I think, are really key, is that when we start to realize that we need to focus on health and prevention and primary care, that's when you think about the future. I think that a lot of our primary care is going to be led and managed by nurses and community health workers.
Yeah, I would agree with that. You mentioned that nurses are everywhere throughout the entire healthcare spectrum, and everybody knows a nurse. My mom's a nurse, my aunt was a nurse, my grandma was a nurse, and they're the people that you go to for all of your healthcare questions, and they're your comfort, they're your the knowledge that you need. And when you go into if you're an inpatient, you connect with your nurse and you really get to know them, and that can either be a really good stay or a bad stay, depending on who your nurse is and how they treat you. And I've always had wonderful nurses in my life, and appreciate all that you do. So yeah, well, thank you.
That point that you were making about nurses being everywhere in so many parts of the world, the highest level of healthcare care or discipline or expertise for many people on this planet, that will be a nurse. I mean, there's just such a shortage of our physician workforce and the pharmacy workforce. So for many people, the only people that they will ever see in their life to receive their healthcare treatment will be a nurse. And when you talk about loving nurses, thinking about midwives, the vast majority of children they come into the world and women give birth to them, and midwives attend and assist. And find me a woman out there who doesn't just love their midwife.
Right. Absolutely. Yeah, really good point. Okay, so let's look at this next question. So how do nurses view their role in light of the shift to virtual care, as we're seeing so much of that now? So what new skills do they need to adapt to this change, and what can we do to help them?
So virtual care is an interesting concept, an interesting term. And for a lot of the world, it feels new because it hasn't been the business model or the practice. But I think for a lot of the world, virtual care is like, well, that's what we've been doing. They are available by phone, they are available by text. And it's been by virtue of the geographic distance. So there are many parts of the world where this isn't particularly new. This has been the standard because of a lack of road infrastructure or just how difficult it is to get to someone. But when we're thinking right now in this new era, what we've learned from the pandemic, where a lot of the care that's being delivered right now or received is through kind of the means that you and I are experiencing right now. We're using the internet, using computers, on cameras to share, here's what's going on, here's what my concern is, here's what my question is. Oh, by the way, can you look at this spot on my hand? Right. So all of those things that we have been accustomed to doing in person, we're now doing over the internet. So there are a couple things that I think we need to think about, and the skills that we need to think about. The first thing is we're changing the power dynamic. When we had specifically in-person care, a patient had to do a lot of travel oftentimes or logistics planning to get to my place where I'm welcoming you in, you're a guest in my world, and I kind of run the shots, literally. But it's a difference in that dynamic where somebody, they're not really in their own comfort zone. And so now we flip this around and I get to come and visit you in your home. So I'm a guest in your home, and it has this subtle change of dynamic. So just on that interaction part, we need to start thinking about that in different terms of, maybe it feels uncomfortable for somebody. Maybe they don't like me being in their home. It also gives us another assessment tool. We get to see how people are living, and that gives us a look at the type of lighting, level of resources that they might have, level of cleanliness, who's in the home, do they have a pet that they're loving? And also they get to be more themselves. They're in their own environment. And so then we're actually able to start tailoring a recommendation or an understanding to the set of circumstances that that person and that, their family might be living in. Because oftentimes we'll make recommendations that have no basis of reality for that person's life. So I think that there's a set of skills that when we move into this virtual world, first of all, it's just using our basic etiquette and our skills of switching from being guest and host. Now we're kind of in the same place and they're inviting us into their home. And then I think we need to start thinking about, now that we've got this additional way to assess people, how do we make that work to the patient's advantage? And I think the other thing about virtual care that's really interesting for us to think about skills is, how do we make sure that people have access to not only to the internet, but is it the right speed? Do people have a device that they can get on? Do they have a skill set to make them feel comfortable getting on that device? And what's the added level that we need to do to secure people's confidence around privacy, around data? I mean, are you recording this, Melanie? What might you do with the recording? How do I know that those pieces of information, and the fact that I might be sharing some really sensitive information with you, how do I know that that's secure? So I love the fact that it provides a certain level of convenience. It democratizes care, so I become more available to people in ways that are easier for them. I'm hopeful that it's going to actually reduce cost and improve the access. And I'm also mindful that it might actually create more difficulty for people because they don't have a device, the literacy or the internet to be able to get there. And then we're asking people to do something new and different. And so I think we need to help people along and make them be empathetic. I mean, I don't know about you, but every once in a while, I can't get onto the link that somebody sends me, or I can't figure out why the internet isn't working. And I've seen that interaction where people start to feel uncomfortable. They feel foolish. They feel like they're not knowledgeable enough. And then it really gets that whole interaction off to not a good start. So right. There are a new set of skills that we all need to be learning together. And my recommendation is to make sure that everybody has a teenager next to them, because they are my technology go-to when I need to figure out why things aren't working. Oh, no, scoot over here. Let me, and they do this magic on their devices. Like, how did you do that? And they just kind of roll their eyes and like, oh my gosh, you are such a digital immigrant. So right. Anyway, so those are some of my thoughts around virtual care, the role that nurses are going to play in this. And like I said, I'm really, really enthusiastic, but I want to make sure that my enthusiasm is also met with the same level of, how do we keep people safe? How do we make them feel secure? And how do we make them feel welcome in this new space?
Mm-hmm. Yeah, really good points there. I definitely resonate with that. My parents just got their very first smartphone. And imagine them having to do a televisit on there because they couldn't even figure out how to send a text message. They had to have my 15-year-old niece help them with that. So, just that learning that new technology, and it is difficult for many people, and then not having the connectivity and accessibility to that technology. So.
Well, and I think we saw a recent very good example around the globe. Pretty much anybody with the COVID-19 vaccine, there has been the priority of, we need to protect our most vulnerable citizens. So those folks who are 85 and above. Okay, so most of the 85-year-olds in my life are not regularly on email. Some of them are. I mean, I know that there are plenty of those that are way switched on, can teach me a lot. But what we saw was for the people who are most vulnerable, who we have asked to please stay indoors, to not be a part of crowds, the way we invited them to access these vaccines, you needed to have internet access, get your appointment, through a portal, have an email address. And a lot of people who are 85 and above and are most vulnerable, they actually don't have an internet account right now, or they don't have an email address, or their vision isn't what it should be, or so many people were trying to click through, and there was just, the internet was so busy with people trying to get those appointments. So we had the right intention. Here's the group of people that we need to reach, and we want to make it accessible. But the way we made it accessible was not really well designed for the group of people that we most wanted to help. Oh, and then by the way, a lot of them, we asked them to please come to these large centers. So they're not driving, they don't have a car, mobility isn't necessarily their strongest suit, and we've asked them to come to be out in public in large centers. So there was a lot in that design that we really need to rethink. And so when we're doing the virtual, we have to think about every inch of that last mile of delivery of virtual care.
Mm-hmm. Yeah, really good points. And that kind of goes right into this next question. What lessons have been learned from the COVID-19 pandemic? You just touched on several of them.
Yeah.
And what needs and recommendations do you have?
Yeah, the COVID-19 pandemic, like any other pandemic, it does a really good job of pointing its finger at everything in our health system that's not working and who it's not working for. And we've had that exact same experience. It also has demonstrated to us that in a place of crisis and in a sense of urgency, we can do hard, big things, and we can do them fast, and we can do them at scale, and we can do them safely. The vaccines are a perfect example. We've got a new technology, the mRNA technology. It's not actually all that new, but from the standpoint of vaccine development, we have not seen collaborations on this scale. We have not seen data sharing on this scale. We have not seen investments in committing to, let's get these vaccines developed. So what we saw over a very short, record-breaking period of time was a coordination and a collaboration of scientists all around the world sharing genomic-based data to use a technology and a platform to create a set of incredibly safe, effective vaccines. We were able to coordinate the research, the clinical trials. We were able to coordinate in parallel their production. So we have demonstrated we can do big, hard things. We can do it safe. We can do it fast. Another example is when we had to switch over to virtual care. Many health systems did not necessarily have they had a platform in place to do virtual visits, but maybe they weren't doing them that often. So what we saw was that ability to ramp up. And they were able to, literally overnight, go from something like 40 visits to 4,000 visits a day. When you take a look at the contact tracing that was done in New York City, there wasn't a contact tracing workforce in place. Over a 3-week period, all of that was put in place, and it was contact tracing for a new and novel virus that everybody was learning in real time. Look at how we mobilized the nursing workforce. We needed more ICU nurses in different parts of the world, and we were able to mobilize. We had, I want to call them pop-up hospitals. That's not the right word. And all of my friends in disaster will like be frustrated with me. But these freestanding hospital bed clinics where they were able to take care of people or to isolate people. So again, we have learned we can do big, hard things at scale, and we can do them safely. I think what we've also learned is that we need to think through the details and figuring out who is being left out when we do this. So as I mentioned, when we were doing virtual care, and we needed to make sure that primary care, that people could get their follow-up care, and they needed to be able to do it at home. if you don't have access to really good internet, you're not going to be able to get into that portal. You're not going to be able to see your data. You're not going to be able to share it. So I think we've also learned where, what those, where the gaps are and who they're most impacting. And we've seen that people who are people of color, people who are living on the lower socioeconomic end of any economy, women, this has been particularly hard on women. They call it the she session for a reason. And when children are not in school, women frequently are the ones picking up that work of taking care of a child at home or taking care of an elderly parent. So we have seen all of those places where we need to rethink our dependencies and our interdependencies. And because this is the AHIMA community, I think what we've seen is the brilliance of how we can use data to see where those hotspots are, where the needs are, where the resources need to go, how we need to shift the supply chain, who needs PPE, who needs ventilators, who needs ICU nurses. And that data allows us to really better manage and navigate what the needs are, how to respond to them, where to go. So we've been learning a lot. And like I said, I think that the recommendations are to think through what we need to have as a system that has resiliency in it, that can respond and can manage multiple crises at once. And so that's going to be, how do we look at our workforce? How do we look at our regulations? How are we looking at how we're sharing our data? How do we work in teams? I think we've learned a lot, and hopefully those are a couple of examples that as people are doing the debrief and more importantly, the planning for the next pandemic, right, because they are coming, what do we wish we would have done just even a couple, 2 years ago that we didn't do? Because when we are through this and it feels a little bit in the past, my great concern is that that urgency that we've come to the crisis with will not sustain us in figuring out what does the prevention and the lessons learned and the resilience building, what are the layers of redundancy that are valuable to have? That's what I think when I say, what are the lessons learned? It's not necessarily getting through the pandemic. It is making sure that when we are no longer in crisis mode, we take those lessons that we learn, we see those gaps, and we start making sure that we build and fill them so that when the next one comes, we don't have to have so much loss of life and livelihood and liberty. I think a lot of people feel like they've lost a lot of liberty.
Right. Yeah. Excellent points. I agree with you 100% on that. Just the speed with which we did so many things was fantastic. And yeah, we don't want to lose that. We want to continue to make great strides like we did during this last year in so many different areas of healthcare.
Well, I do. I think that what it showed us is that there were a lot of things that if you had said, hey, healthcare system, can you switch your outpatient setting into complete in-home and do that over a week? They would have laughed and said, no, healthcare setting, not possible, can't do that. And I think what we've learned is that we can do those things. Mm-hmm. And as one of my colleagues, Karen Dale, she's the CEO for a health plan in DC. She said, what we've learned is that we can do those things. And every time we don't, everything else, it's just an excuse.
Right. Yeah, that's a great statement. I love it. Yes, very good. Okay, so our final question for you is, what do those in decision-making roles need to know and do to capture and harness the expertise, experience, and insights of the entire healthcare talent pool?
Yeah, so that's a big question, but it's actually a pretty simple answer. We have this enormous talent pool, and the vast majority of where we've driven healthcare innovation, we've looked at a very small group of people that we think can drive it and are well positioned to do it, or educated, or have the leadership skills to do that. And what we know, particularly what we've seen in the pandemic, is that when change and innovation needed to happen, when we needed to solve a problem, it was actually the people who were closest to the problem that understood it really well and were able to articulate, here's the problem, here's what we actually need to solve. And then from there, they had a lot of really good suggestions. And so I think those folks who are in the leadership roles, what they need to know is that there's a whole lot of insight in that great big huge healthcare workforce. And that can be from your pastoral care, that can be from pharmacy, that can be from people in records and in lab, a lot of people that we don't see in the patient room, and oftentimes we don't name. And frequently I mention nurses, and the reason why I call out nurses is just by virtue of how large the workforce of nurses are and the proportion. They represent 50% of the global healthcare workforce. And they are going to be the ones who spend the greatest amount of time with patients and their families, and the proximity and the level of trust that they have. So for those folks who are in decision-making roles, who are leading health systems, the public and the systems are really missing out when we're not tapping into the full breadth of all of those insights, all of those talents, all of that experience. And frequently what we do as health systems is that we hire people based on their training, and we hire them into roles that are meant to perform and to manage tasks. We don't think about them as talent, and we don't develop them as talent, and we don't think about a career pipeline. And when you think about folks who have clinical knowledge and operational knowledge and regulatory knowledge, what happens if we start thinking about the people that are on our teams and those talent, and we start developing them with a career trajectory that is focused on making sure that those clinical skills get developed and protected and honed for a longevity. And so maybe these careers, they start looking like, when we hire you into a role, some of it's going to be clinical time. Some of it's going to be leadership time. Some of it's going to be innovation. Some of it's going to be education. Some of it's going to be research. But it's not an either or. It's a portfolio of work. And so many of the folks that are in leadership positions and decision-making roles, I think that there's a very narrow understanding of what a pharmacist does, what a social worker does, what a nurse does, as opposed to thinking of them as health innovators that should be tapped into and be brought into different teams and different projects, and giving each one of them, as they want to, an opportunity to develop a career that allows them to move laterally into operations or program management or advocacy or education. And I don't think that that's what's happening right now. So when we think about the people in the healthcare workforce, I think we need to be thinking about them as talent and insights and expertise that we need to protect and to develop, and think about them as the pipeline for how our health systems are not only going to run, but how they're going to get better and how they're going to address the needs of the future. And I do want to say, from the standpoint of protecting our healthcare workforce, we need to have workplaces that are psychologically safe, that are physically safe. And that's not only from the work, but shockingly and sadly, there's a lot of violence in our workplace. And nurses and women are the ones who are feeling the brunt of that. They're the ones who experience all of that. And what we've just come through with this pandemic, we have never, ever, ever been emotionally prepared to see the amount of death that we've seen, to see the type of death that we have seen. And we have never been in a situation where we've also had to be the proxy family to make sure that people do not die alone. And then to try and somehow or another have a link to the family and the loved ones who weren't there, who are suffering greatly. And that is an awful lot to ask of those healthcare teams. And so as we move forward, we need to acknowledge that. We more than acknowledge it, to say, yeah, we see it. we need to intervene. And it's not a function of waiting and seeing how many people at a very late stage in crisis, when they're really suffering from PTSD, we already know that this has been stressful. So when I say protect our health workforce and those people who have been so close to this horrific collective loss, we need to take care of them now, and we need to do it proactively. We need to assume that they need help and support. And then we need to normalize that. And so that every time, everybody, every place where healthcare teams work, that the norm is we take care of the people who take care of the people. And that has not been the case. And so I think that those people who are in decision-making roles, they have enormous opportunities to improve our health systems and the health outcomes and the health experience for every single member of that healthcare ecosystem.
Yeah, such great points. I absolutely agree with you that we don't recognize them enough, and I really wanted to touch on the point you made about the various different roles that nurses do, and not pigeonholing them into one specific role. And same with pharmacists and radiologists and HIM professionals and most healthcare workers. There's so many different roles that they do, and to look at that individual person and see how they can grow and progress, and look at all the opportunities out there. And yeah, so really great information today, Shawna. I appreciate you sharing your insights. It was very heartwarming, and makes me appreciate nurses even more just to hear your insight of everything that you've been through in this past year, and continue to go through all the time. It's really shown a spotlight on the great work that nurses do. So I would like to thank you and wish you a happy International Nurses Week, and thank you for everything that you do.
I appreciate that so much. And I will say, I didn't mention this in my introduction, but I am the host of the podcast See You Now, which is done in partnership with the American Nurses Association and Johnson & Johnson. And the stories that we are able to share really go a long way to what you were talking about, Melanie, as far as helping people to have a much, much, much broader understanding of what nurses do, what they have done, what they are doing, what they can do, and hopefully counteract this perpetual underestimation of what nurses do. And there are absolutely remarkable, remarkable stories of innovation, of research, of activism, of advocacy. And so while you've got one little snippet of some of the work that I've been doing, I really feel like I am very blessed and very fortunate to be able to tell these stories and amplify the work of nurses that are taking care of moms and babies and the elderly and vaccinations and mental health and you name it. The human experience comes in so many interesting flavors. And I can promise you, there are nurses who care about every single one of them and are fiercely and ferociously and courageously advocating to make sure that the patients and those conditions that they care so deeply about get really good care and have a life that is meaningful to them.
Mm-hmm. Excellent. Well, thank you so much. And we'll have people check out your podcast so they can hear more from you, and appreciate all that you've shared with us today. And again, happy International Nurses Week.
Thank you, Melanie. It's been great being with you.
Thanks.